Markley,
Here.
Walters,
Here.
Philbrook, Commissioner Philbrook,
Here.
Bynum,
Here.
Burrows,
Here.
Townsend,
Here.
McKiernan,
Here.
Ramirez,
Here.
Johnson. Commissioner Johnson, are you there? Alvey.
Here. Thank you. Our first order of business is a resolution to extend the state of local health emergency for the COVID-19 pandemic for Wyandotte County through May 18th. Doug, would you just give a description why this is necessary?
The extension of the local emergency was one that was first declared by the mayor last week under his authority. It is one he can do for a period of 7 days. He could continue that in increments. However, we felt as this is going to continue forward for a number of weeks, we put this before the governing body and asked for you to go ahead and make this declaration for a period of 60 days.
Thank you. Are there any comments or questions from the commission?
Move for approval.
Second.
Second.
Thank you. We have a motion and a second. Roll call, please.
Roll
Gordon
call.
Criswell.
Is now joining.
Roll call on the
Angela
motion.
Markley.
Is now exiting.
Roll call on the motion. Kane,
Aye.
Markley, Walters,
Aye.
Philbrook,
Aye.
Bynum,
Aye.
Burrows, Commissioner Burrows,
Shit.
Markley again.
Is now joining.
Commissioner Markley, we're taking roll call on.
Burrows is here. Yeah, aye.
And Commissioner Markley, to back up, we're taking roll call on the extension of the local health emergency.
Okay. Do you need my eye or you haven't been called yet?
Yeah, I'll take that as an aye.
It is.
Townsend,
Aye.
McKiernan,
Aye.
and Ramirez.
Aye.
Motion carries 9-0.
Thank you. Next, we have two items under the administrator's agenda. The first item is an ordinance relating to violation of orders by the local health officer or
Harold
board.
Johnson.
Is now joining.
A violation of orders. This is not a violation of orders by the local health officer or board of health. It is related to what their actions, responses would be when there were violation of orders. Is that correct, Kenny?
That's correct. This ordinance allows us to prosecute in municipal court and also facilitates the police department, the sheriff's department, when actually issuing a citation for a violation of the order. So really, it streamlines that process.
Thank you. Doug, do you have more to add?
No, I believe the comments by Ken are accurate, and it just allows us a little bit more flexibility in how we move forward with any violation at the local level.
Thank you. Do any members of the commission have any questions or comments?
This is Commissioner Burrows. Do we have a level of fines available? Do we know what the fine would be?
Commissioner, it is a Class C misdemeanor, which has a maximum fine of $500 per violation.
Thank you.
Any other questions? We had a motion for approval from Commissioner Kane.
Second.
A second from Commissioner McKiernan. Roll call, please.
Roll call. Kane,
Aye.
Markley,
Commissioner Markley.
Walters,
Aye.
Philbrook,
Aye.
Bynum,
This is Markley. Aye. Bynum, aye.
Burrows,
You cut out Commissioner Burrows.
Aye.
Thank you.
Townsend,
Aye.
McKiernan,
Aye.
Ramirez,
Aye.
Johnson.
Aye.
Motion carries 10-0.
Thank you. Item number 2 is a resolution appointing coroners. Mr. Bach?
Thank you, Mayor. This is a request that, as we move into this time, we've already found to have a little bit more flexibility based on the timing of an action that may come about. As we go forward, this gives us flexibility, gives me the flexibility to be able to appoint a deputy coroner or the coroner to appoint a deputy in the event we need it. So we thought it would behoove us to bring this forward at this time and request for that approval.
Thank you. Any questions or
So moved.
comments from the commission?
Motion to approve.
Second.
We have a motion from Commissioner Bynum and a second from Commissioner Kane. Roll call, please.
Roll call. Kane.
Aye.
Markley.
Aye.
Walters.
Aye.
Philbrook.
Aye.
Bynum.
Aye.
Burrows.
Aye.
Townsend.
Aye.
McKiernan.
Aye.
Ramirez.
Aye.
Johnson.
Aye.
Motion carries 10-0.
Thank you. That concludes the portion of our special commission meeting. I adjourn us in that capacity. I now call us back to order as the Wyandotte County Board of Health. We have 2 items. The first is an update on the coronavirus. Deputy Director of Public Health Terry Garrison is here to provide the update.
Thank you, Mayor Alvey, and commissioners, wherever you may be. I wanted to give an update. So far, at this point, we do have 9 lab-confirmed positive cases of the COVID-19 in our county. You can find current case counts on our website, which is wycokck.org/COVID-19. We are investigating all of the contacts. We're doing contact investigation on all of 9 of those folks that have tested positive and trying to find out where they've been, doing tracing of where they've been, who they've been in contact with, if those folks have had any symptoms, and making sure that they, in fact, self-quarantine to see if they develop symptoms or need to be tested, those kinds of things. We are also setting up a process for testing. We have testing a safety net provider at Southwest Boulevard has agreed to do drive-through testing for the other safety net providers. However, you do have to go through a safety net provider to get triaged and make sure that that they've gone through the triage tree before they can approve for you to be tested. So that started today, I believe. And I don't know how many they actually had today. Have we heard, Dr. Greiner?
Yeah, we've heard. This is Alan Greiner. 4 tests were administered today. Most of those tests will be going to private laboratories, either Quest or LabCorp reference labs in the area. We're trying to work closely with that testing site to help with protocol development, help with follow-up. They have volunteered some of their staff to do follow-up, but we will also be doing contact investigation and tracing with those individuals and any contacts they may have. I'll also note we've increased the size of our contact investigation activities. We've got an operations center that we expanded today with some training we delivered to new individuals, and we hope to expand that more with some of the physicians who are trainees from the University of Kansas Medical Center, as well as possibly volunteers from Heart to Heart International, who has offered some of their volunteers that have done infectious disease work internationally in previous disaster areas. So we're pretty happy about that. Johnson County has decided not to continue contact tracing on their patients and contacts because they have been designated as having community spread, which means essentially that they've had positive cases where they could not determine where that particular positive case could have contracted the disease. We've so far been moving forward with the idea that we may be able to sustain our contact tracing and investigation activity, and hopefully we can continue it indefinitely, because we think it'll allow us to control spread better. As we do this, we ask a lot of people to go into voluntary 14-day quarantine. If they're asymptomatic but they had close contact with a positive case, or with a case that we call presumptive positive, we're now moving into the phase where we are probably also going to have to designate individuals and have community members self-designate themselves as presumptively positive. And the reason for that is there's a shortage of testing kits and testing resources in the region. In fact, we're getting a lot of pressure from one particular local hospital that feels like community testing is causing a burden on their ability to test and on their ability to have enough personal protective equipment in the hospital setting. We're still trying to negotiate out all the features of that, but we feel like having at least some community testing and having as much contact investigation as we can have will help us, especially given the fact, as we all know, we have a community that has a number of vulnerable segments, and we want to do everything we can to try to limit impact there.
So we're setting up a self-report application so that folks can self-report their symptoms and also the severity of their symptoms that it's their self-report of. And then we can get back with them. We can come back around behind them and follow up with them and do kind of a presumptive positive for the folks that actually give us that information, and it appears that they potentially would be positive. And that can help us with hot-spotting different areas within our community to know kind of where we might be actually seeing some pockets of infection, though we don't actually have the test to prove that. So some things that are going well. We've had great help and collaboration with all of the UG departments from everywhere, from communications and IT, and just every department within the UG has been great. We also have some assistance with external partners, all of our safety net providers. Wyandotte Health Foundation is coming on board to help with some funding sources for our safety nets. We have Matt May is with our emergency department, and he's been taking the orders for all of our personal protective equipment that we need to be ordering. We've also had other people. We had our epidemiologist who used to work with us. She has reached out and said, I can volunteer to help do some of this, so it's been great. Some of the challenges is our supplies, making sure of our supplies, both not only internally at the health department, but most importantly, externally at the hospitals, as well as at the safety net providers and other healthcare providers that are seeing these folks, making sure that they have sufficient supplies to protect the healthcare workers who we need, obviously, to be healthy, as well as our EMS folks and our police officers. So we need to make sure that they're well supplied, and that's been a challenge, as well as you heard Dr. Greiner say, just testing supplies, making sure that testing supplies are available so we can continue to do those as needed. Sorry. Again, the same message. What we need to say is social distancing each other, making sure you stay home if you are sick. Please do not go out if you're running a fever, if you have a cough, if you have signs of COVID, unless you're going to your healthcare provider. We need you to wash your hands constantly. Soap and water does an amazing thing. If that's not available to you, use your hand sanitizer, and just protect your families, protect the community as a whole, and protect your neighbors and look out for them as well. So try to keep that social distancing, I can't say that for some reason, and handshaking. Don't do handshaking, and keep the 6 foot for less than 10 minutes kinds of things, And we're working with the unified government as well as other areas for keeping those things.
Folks may have seen this, but there's a whole lot of information at wicokck.org/coronavirus. We hope to have the self-report symptom page embedded within there by tomorrow morning. We're working kinks out with that now. We're following the lead on a heavily hit county in Colorado on that initiative, and we'll see how that goes. We'll try to do contact investigation with all those folks as well, but the website's really great. The Health Department Public Information Officer Janelle Friesen has done a wonderful job with that work, as well as the communications team with the UG. So I think we're going to keep working on that, and if there's feedback, I think we'd like to have it so we can keep making that better. I think at times when we throw this science out and it's all happening so fast, we're forgetting about literacy issues and numeracy issues and issues that our population might have in terms of digesting that info. So we'd love feedback on that as we go.
Thank you. And Commissioner, before we take questions, I think maybe we can anticipate some of those. Momentarily, I'm going to have Administrator Bach give a description of the operations side of this from the unified government. I just want to let you know, and you probably saw it through the Facebook Live, but as soon as this hit, we began to meet as a collaborative of community stakeholders, which really led by our public health professionals from the Public Health Department. But that daily meeting, conference call, includes the hospitals, University of Kansas Health System, Providence Medical Center. It includes our social service agencies. It includes Wyandotte Behavioral Health, Donnelly College, Kansas City, Kansas Community College, Mayor McTaggart of Edwardsville and his staff, Mayor Harrington of Bonner Springs and his staff. And in all these efforts, we are trying to make sure that we are gathering the right information, getting the right answers, and we've really tried to take a longer view of this. We're really trying to look at the experience that has been had by other nations, Italy, South Korea, China. What did they do? What was their time frame? We're looking at what is happening in other parts of the nation, obviously. We're trying to stay out in front of this and ask ourselves, well, if in 2 weeks we think we're going to be at this place in terms of public policy or ordinances, why would we not move that place now? The whole point in all this has been to flatten the curve. The constant refrain across the country and across the world is that you need to flatten. You're going to have exposures. You're going to have people infected. It's already happened. It's going to continue. We want to avoid a spike that would overload our healthcare system. So the recent decision by us and by Johnson County and Jackson County and Kansas City, Missouri, to close restaurants and bars was really an attempt to get out in front of that, because that's what is happening elsewhere. And so all things are being considered. All options are on the table practically every day, and at the same time, we're trying to anticipate additional problems. Let's say, for instance, what is this going to mean for our mental health care providers, and what kind of resources do they need, and what kind of information do we need to get back from them? So it's a very good discussion. It's a great collaboration. I think it's been very effective, and we're going to continue on. So having said that, I'm now going to pass it over to Mr. Bach.
Thank you, Mayor. As the Mayor stated, as soon as we went into this situation, we started also having meetings with people that are out in the field doing responses to everyone. First and foremost was, what do we need to do to protect the people of this community? But also with that, also wanted to make sure we were putting all the measures in place to protect the workforce that we have out there, the many first responders that we have that are going out on a daily basis through our police and fire and sheriff's departments, as well as our health officials that are out there meeting with people every day, interacting with them and taking the steps. So we've been working with the state of Kansas and others to try to get additional supplies in. There's still a big task to go through in trying to do that, because we know we are limited in how long we can go, but we will continue to fight and do our best to get that in place. This week, we began closing many different offices within the government operations and our court systems. Reacted quickly with us to make some short-term closings, and now they have done so to take it long-term. So effective Monday, we will effectively close our operations to the public, and that includes both in our motor vehicle area for those tags. There will be some leniency that's out there for someone if you bought a new car, but a lot of stuff is still available online, so you can do your work that way for all renewals and such, or through the mail. Court systems have suspended through April 17th or through the 20th. That's the kind of the Friday, Monday between what we're doing at the municipal court level and the district court level. The only exception for the district courts is that they will have some cases that will come forward. Those will be designated by the judge, and others will be notified when they need to come to that. Otherwise, individuals will not be allowed to come into City Hall, the courthouse, Neighborhood Resource Center, or our annex operations until further notice. We will continue to have some public meetings. When we do have those, we will announce that, and we will open our doors approximately 15 to 30 minutes before those meetings start until we come up with other arrangements for the public to participate in those meetings. Other exceptions to our openings will be with our police headquarters. South Patrol and Midtown Patrol will still be available for people to walk in and provide reports. We do have glassed-in areas in those areas for security purposes. And transit operations will continue to operate throughout the metro at this time, and we will continue to work our bus service in coordination with what is going on with the metro, where people are still in need of this service. In saying that, I would continue, and I would encourage people to use our website, as was stated earlier by the Health Department. It's wicokck.org. You can go in. All the postings that are out there regarding COVID-19, the daily updates, they're on that site for everyone to access. So it's real important for everyone to continue to look at that and reference that site for material. Mayor, that's all I have, but I would answer any questions anyone may have.
Yes, and I just want to reiterate, I think it's very important as we get calls from constituents asking questions or texts, that we first of all refer them to the website, and that if they don't get the answer there, that's important for us to know that maybe another question that we need to answer and get out there. But always move people to the website, have them try and get that information, and continue to use that, because we are trying to get as much information on that website as possible. Also say that in addition to this collaborative group, stakeholders from across the county, we're also trying to bring into the loop, we're getting more and more questions from the business community, and so there will be, we'll be beginning teleconference calls with the Kansas City, Kansas Chamber of Commerce, the Bonner Springs, Edwardsville Chamber of Commerce, Wyandotte Economic Development, and other business groups, so that we can, first of all, hear their concerns, carry their needs forward. So we're going to do that on a regular basis. It may not be daily, but it will be as needed, as much as necessary. And also, want to appreciate, give a shout out to Commissioner Johnson, who is reaching out and sent to us great contacts throughout the city for the pastors. We are going to be conducting some regular teleconference calls with the pastors who have special ways of communicating with their congregants. We appreciate their cooperation, the pastors' cooperation in keeping crowds below 10 or numbers below 10. That's very important. As we all know, we're simply trying to flatten the curve, and if we can limit the contact everywhere and anywhere, it just gets us that much further along. So having said all that, I know you have a lot of questions, and we'll take questions.
This is Angela. I just want to say to staff in particular and to you, Mayor, thank you for your leadership this past week. Obviously, this isn't a situation where every commissioner can be involved in every decision. Things are moving much too quickly for that. So I appreciate that you guys have been in the trenches taking care of these issues while we have literally, in most cases, been sitting at home. So thanks for your leadership.
Well, thank you.
Mayor,
Yes.
it's Commissioner Bynum. I do want to echo what Commissioner Markley has said, and I really appreciate your leadership and the leadership of Mr. Bach And I want to extend that out to our public safety folks in every department. It's been amazing to watch the cooperation and teamwork that has transpired. And the only other thing I really want to add is this community has shown us once again how resilient we are. I'm on social media watching neighborhoods take care of each other, small businesses modify their business practices, and the community stepping up to support them, and on down the line. Just every segment of our life has been upended, and yet we're all stepping forward to support one another, and it's been really incredible to watch. So actually my shout out is to all of Wyandotte County. Thank you very much.
Thank you.
Commissioner Ramirez, again, echoing everything Commissioner Bynum and Commissioner Markley has said, but all the actions that our administration and staff have taken says volumes to the dedication that they have to this community. So I thank you, my district, and the constituents in my district. Thank you.
Thank you, Commissioner.
Mr. Mayor, this is Brian McKiernan. In watching the YouTube presentation here, there was one person who did comment. I called the health department to see where testing was done, and they gave me another number to call. And I thought it might be good for us to reiterate one more time our standard procedure that we don't do the testing and what steps we take to redirect people who would call us.
Yes.
Yes, Commissioner McKiernan, we do not do testing at the health department. We have several safety net providers within our community, including 3 federally qualified health centers, and so we turn to them for the clinical arm of the public health system and ask them for that assistance. And that is so that's where we would have them go, is to one of the safety net if they do not have their own private care provider. If they have their own PCP, then we would want them to go there. If they don't, then this is the opportunity for them to learn of our great safety net folks that work with our population.
Perfect, Terry. Thank you so much. I just wanted to make sure that people clearly understand that we, as a unified government, don't do the testing, and that we then would refer to someone else to carry that out.
Correct.
And I'm being reminded by our PIO that they need to call first don't just show up at their door. They need to call first, because if they are showing symptoms, we want to make sure that the provider is prepared for them and can make sure everybody in the clinic is safe.
Perfect. Thank you.
This is Commissioner Johnson. First of all, Mayor and County Administrator, you're doing a great job of getting the information out, and I appreciate your diligence in getting the information out and making sure that it is out there consistently. I also want to appreciate my fellow Commissioner Townsend for making sure that UGTV is being updated more frequently as well with all of the information that we have. It may have already been stated, Administrator DeBach, but if you've already spoken to this, maybe you can reiterate whether we're getting information out in multiple languages so that our diverse population, we can speak to all of those persons that are represented in our community. Thank you.
Yes, Commissioner, we are sending information out in Spanish. I believe I'd have to look to my PIOs if we're doing anything else, but. Would you use microphone, Janelle?
Yes, I am Janelle Friesen, the PIO for the Health Department, and we are working with some of our staff who are multilingual, as well as some of our partners and services that can provide those translations to get additional materials, both like print materials and things on the webs and videos that are in different languages.
Okay, so we are currently out in English and Spanish, and then working on additional languages as we can.
And I will add.
Great, thank you very much.
And Commissioner Johnson, I'll add that specifically I've been able to reach out and make contact with Spanish radio stations. There are 3 Spanish radio stations in the market that are religious, faith-based. So we've reached out to them. We've also reached out to the largest Spanish radio station and are providing them with information. I've also reached out to the Hmong community and tried to work through their network to make sure that any questions they may have, we're able to get that information to them.
Thank you.
We've also been working with the refugee resettlement program at Catholic Charities as well.
Good evening. This is Commissioner Townsend.
Yes.
It's already been stated, but it's certainly worth echoing again how we appreciate the guidance and leadership shown by Mayor Alvey, Administrator Bach, our health department officials, and all the employees of the unified government and our first responders. Commissioner one of the commissioners has already clarified, I think, that if someone believes they are exhibiting symptoms, that their first call should be, I believe, to their primary care physician. Is that correct?
Yes, that is correct.
Okay. And I would like to ask Administrator Bach again to talk about the changes and delays in the court system and how individuals will know if their scheduled hearings have been postponed or if they need to come in. I wasn't really clear on that one. Thank you again for all you all are doing.
Okay, thank you, Commissioner. On the district court level, that is one where those hearings are, the jury trials have all been pushed back indefinitely until they're able to come back in and set that up. Individuals that have hearings that they need to come before a judge, that's communication with their lawyer and the individuals specifically regarding that. For municipal court, our announcement is out there. I know we tried to put a large mailing, and Ken, you may have a better understanding of what we did. We tried to put some communication to people that did have court dates in place. However, most of it is through the notification that we are just not open during this time period, and they will be extended. Ken, do you have any add to that?
My understanding is that the municipal court has reached out to people who have current settings now and advised them that everything will be set to some date, I believe, past May 3rd. And the prosecutor's office has reached out to the victims of offenses and witnesses, whatever, also notified them.
Okay. So we're doing what we can to reach out to those that we did have preset dates with and communicate them about to be rescheduled. We're not setting those dates until we know, I don't believe we're setting those dates until we know when we're able to go back in session.
Thank you.
Certainly.
Okay. That seems to have been...
Commissioner Burrows here. Sorry. Do we have, as commissioners, a point of contact that we can call in and ask questions? I know you said refer everybody to the website, but I know there will be some people that won't have access to social media. Is there somebody we can specifically have as a point person to call in the questions we might have or get to help guide us?
Commissioner, I would ask that you contact Assistant Administrator Emmerich Cross, and he will either answer your question or get the appropriate person to answer your question.
I appreciate that. And I know these are very challenging, uncharted times. I think the leadership has been demonstrated by those that are working collectively to ensure the safety of our community is first and foremost, and that we're prepared as we can be under the circumstances. I commend you all. It is quite challenging. We've seen it on the state side. We are here as partners. I commend you all. So thank you so very much for the time you put into this and for the update.
Thank you. So I would like to also, again, thank all the commissioners for all the work you're doing and your leadership in the community. I think especially at this time, it's the communication piece is extremely important. One of the reasons why we wanted to convene the collaborative of anchor institutions and service providers across the county on a daily basis was simply to drive out inaccurate information or to, fill a vacuum of a lack of information, that the more stakeholders who were engaged in the conversation at all levels, the better that information is disseminated among people. These are people who are respected, who are leaders in their own areas, and their voice carries a lot of weight. And the fact that they have that information and are part of the discussion moving forward, I think has been very helpful. And so that's why we really want to continue to push information out to the commission. We thank you. If you go on social media, if you see something that really needs to be challenged, please challenge it. I think it's dangerous for us to leave voices out there that are, frankly, sometimes being irresponsible. And we have to challenge that. This is not a time for people to use this crisis somehow as a way to make some kind of petty, win some kind of petty battle. It's not what this is about. And no one in that collaborative feels that way and acts that way. And unfortunately, as we all know in social media, people believe that they can say anything they want and make any kind of comment without good information. This is not the time for that kind of activity. So thank you for your leadership in taking on some of that lack of information and that, frankly, some purposely bad communication. Just as an example, I got a text from someone wanting to know if the liquor stores in Wyandotte County are closed, and I could say, no, did you hear any alarms go off? Because alarms would have gone off if that had happened. But again, that kind of information gets out there and spreads, and we have to challenge it. So thank you. Okay, our last order of business is a resolution ratifying and supporting the emergency public health orders issued by Dr. Alan Greiner in his role as local health officer on March 16th and 17th of this year. Do any members of the commission have any questions or comments? Hearing none, I'll entertain a motion.
Move to approve.
Second.
Second.
We have a motion from Commissioner Markley and a second from Commissioner McKiernan. Roll call, please.
Roll call. Kane.
Aye.
Markley.
Aye.
Walters. Commissioner Walters.
Aye. Aye.
Philbrook.
Aye.
Bynum.
Aye.
Burrows.
Aye.
Townsend.
Aye.
McKiernan.
Aye.
Ramirez.
Aye.
Johnson.
Aye.
Motion carries 10-0.
Thank you, commissioners. That concludes our special meeting. We are adjourned.